But the therapeutic medicines are tremendous, and that is something for you to be very proud of, and your administration's done a tremendous job for the state of Florida and the country. So thank you.
And I just signed an executive order whereby the gentleman on my right can go out and buy your prescription drugs at a number that you'd never thought possible. And I assume you're going to be doing that pretty soon, Ron, right?
Yeah, no, Wilton was involved in that legislation in the legislature, so we're excited about it. I'd also say, just with respect to the long-term care, your administration is sending to a number of facilities throughout the country, nursing homes, point-of-care tests there as well. Now, we are testing all the staff every 2 weeks. We have over 200,000 staff because we have over 4,000 facilities. And then if there's an infection, then we go and look to see if the residents need to be tested. And we've already tested all the residents throughout this pandemic. But the point of care, I think, is going to be less even for staff or residents, but for allowing visitors again. We've not had visitors in these places since mid-March because we feared having the introduction of the virus. And I think that that's the right decision to protect life, but that comes at an enormous emotional cost because you have elderly folks who want to have that human connection. And so if you have a 15-minute test, you can have the family members go, take the test, they can go in and see. That is important for health too, because mental well-being and everything is just really, really important. So I want to thank you for doing that. It's really good. I think it'd be interesting. Justin really can give you a good synopsis about where the Florida trends are. I mean, if you kind of read what people will put out versus what the data we see, there's obviously a discrepancy there. And Justin's been there, and so we talk with all his CEOs. We talk with him every day about capacity, about the trends, about the discharges, and we've been able to handle this. We got some great people working very hard, but really there was a lot of foresight into using the last few months to prepare for when we would have an uptick.
Go ahead, Joseph.
Yeah, our alliance has hospitals running from Pensacola all the way down to Miami, and we've seen probably between 40 and 50% of the COVID patients, positive patients in the state of Florida. We are coming through a difficult month. But there are real reasons, and I think you touched on them in your opening remarks, for cautious optimism right now. We have seen, almost every one of our members has seen either their census leveling off or actually starting to decline. And there's real hope, I think, that August we're going to see some acceleration there. The key is to keep working together. I think some of the difference makers in terms of the outcomes in Florida and why Florida has fared relatively well has to do with the decisions around long-term care facilities and requiring 2 positive tests before a patient is discharged from a hospital to a long-term care facility. I also think that the state has done an excellent job of relieving pressure on the hospitals. We have a lot of patients, elderly patients, that are in the hospital, they're COVID positive, but they've stabilized and they no longer need to be in the hospital, and you can't discharge them to a long-term care facility because they're still COVID positive. The state, that creates a lot of pressure on the hospital to have that patient still in there. It takes up capacity. The state's done a great job of setting up COVID-only facilities that have allowed us to get those patients out of the hospital, get them to a comfortable place where they get the treatment that they need, they get the services that they need, but the hospital has the capacity. Our hospitals are all participating in these clinical trials. Remdesivir was one that our hospitals participated in. They're participating in the antibody studies, and we have a lot of hope on those as well. And I think that the cooperation between the state, federal government is something that we've certainly seen firsthand, and we definitely appreciate all the work that's gone in.
Well, you've really done a good job in the nursing homes. When I look at you compared to other places, frankly, you've really done a great job in nursing homes. I know you focused on it, but that's been a very good situation compared to other places.
Yeah, and I mean, so, when we did these COVID-only facilities, our thought is, one, we're doing testing in the nursing homes. There's a lot of nursing home residents who don't develop really significant symptoms either. But if they can't be isolated in the nursing home, what can you do? You can send them to the hospital, but they don't need to be hospitalized. So we have these facilities that can accept the transfers. Then when they clear the illness, then they go back. So it's good for the resident if they don't have to be in the hospital, not have to go. But then for the other residents to not have somebody there spreading it, because that, we obviously don't want to see it spread anywhere. But if there's one place we don't want to see it spread, it's in the long-term care facilities.
Well, that's been really an amazing job. Kathleen, please.
Thank you, Mr. President. It's an honor to be here. I want to thank you and your administration and the governor and his administration. I've had the wonderful privilege of serving as a mayor of a city and then the House of Representatives and now as a county commissioner. And I've always held very tight to home rule. And I think that our success, particularly in Florida, is because you left it to the local communities to determine what was right for each individual community. And I think that way we were able to strategically come up with our approach that would really be comprehensive. And when we needed help, Governor, your departments were there. They were right there to help us. And the CARES Act that we received, $170 million, helped us not only prepare for PPE and do training and testing, but we've done a lot of training in every single nursing home, and that's something where ACA really stepped up and helped us with and made sure that we had teeth that we could go in there and really ensure that they allowed us in, because at first they didn't even allow us in. So providing the resources has been great, but allowing us the autonomy to come up with a plan that's individualized for each individual county, I think, has been the best way to attack this approach. So I really appreciate kind of taking the hands-off approach and just providing the resources and letting the local community do what they need to do. And it's been very successful. Our positive rate now went down from a 14% to a 6 or 7%.
Oh, that's great.
So in Pinellas County, we're doing really, really well, and our nursing homes are doing well, and our hospitals as well are having relief. And so
Great.
we're in really great shape. And so thank you for all the resources.
Good job.
Thank you.
Really good job. Thank you very much. Please.
Thank you, Mr. President. Thank you for having me. I'm the lone Miamian here at the table, but I wanted to say thank you for your leadership under this time. We have two great senators that have done a phenomenal job, and Senator Rubio, although he's not here, has really been the flag bearer when it came to PPE. And in my district, which is in Miami, I've seen the small businesses survive because of your assistance and leadership during this time. And at the same time, I think Senator Rick Scott has been very vocal in making sure that taxpayer dollars don't get used for some of the states that are trying to use them as a bailout.
Right.
And I think that's very important. It's a point that you continue to hammer along with the senator, and it's one that we here in Florida have to continue to voice as well. But in Miami, the assistance has been so important, specifically when it comes to the elderly population. I think there's a stat that I had seen a couple days ago that's stuck in my mind, which was roughly around $80 million has been used for meal assistance for the elderly. And I have a very elderly population in my district. And that comes out to about 9 million meals for individuals that are not able to go out for reasons that are private to their own, but nonetheless wouldn't be possible without your leadership. So on behalf of Miami, we want to say thank you very much, and once again, welcome back home to Florida. That welcome on the way over here. I've never been a part of a motorcade, Mr. President, but I got chills. The love here for you is very real.
That was an amazing group of people, wasn't it?
Yes, sir.
As long as we rode, and we rode a long time, we had tremendous crowds, and we appreciate it, and we love Miami. We'll take care of it.
Yes,
Okay?
sir.
Great job you're doing. Do you have any questions, please, for
Mr.
anybody?
Mr. President, how concerned are you about your political standing in Florida, given the number of deaths we've been seeing in recent days here?
Well, based on the polls, I'm doing very well in Florida, and the local government is doing a fantastic job. I think we're doing really a fantastic job, and we're getting everything that they need. They've, for the most part, had it anyway. We had it all stocked up and stacked up, and you remember I used to say the cupboards were bare federally from the federal standpoint. We had very empty cupboards. Whether it was the military or the cupboards for medical, they were bare. And I think Ron and Rick would both say we've really supplied you with a lot, not only having to do with the medical and the COVID, but having to do with a lot more, in particular some of the hurricanes. Your time and your time, we had some really bad ones, and we came through, so the polls are looking very good. And I think when you see those crowds of people along the roads, there's a very good feeling.
But what about the number of deaths we've seen in recent days here?
Well, I hate it anywhere, but if you look at other countries are doing terribly. This is a horrible disease. This is a disease that should have never happened. It's something never should have been allowed to get out of China, but it did. It came here, went to Europe, it went all over the world. It's in 188 countries. And I will say this, proportionately, relatively, when you look at your nursing home situation, it's a tribute to your governor and government, the job they've done. You've done a really great job, and you have a very big nursing home population. You've done a fantastic job. So I think we're doing really well in Florida. Yeah.
Mr. President, you told Axios in an interview earlier this week that you did not bring up the intelligence assessment with Vladimir Putin, that they had been placing bounties on our soldiers' heads. You said it was because no one had brought it to your attention, but it wasn't your presidential daily briefing. Have you been reading that briefing every day?
I
since
read it
was
all
in
the
there?
time.
Did
I
you
see
read
it all
today?
the time. It was never brought to my attention. I think it's another Russia hoax. They've been giving me the Russia hoax, Shifty Schiff, and all these characters from the day I got here. And we're working with Russia right now on a non-proliferation agreement, nuclear non-proliferation, and we can get something like that, it'd be great. But it was never brought to my attention, and because it didn't reach the level, there were a lot of people, including Democrats, that said it never took place. If it did take place, it would have been brought to my attention, and I would take very strong action. There's been nobody tougher with Russia or China than I have, not even by a long shot. When you look at what we've done compared to the past administrations, it's not even a contest. We've been very tough on Russia with the sanctions and so many other things, including letting people know that we're not so happy about what's going on with NATO and the oil. But speaking of NATO, we've raised $130 billion a year from countries, as you know, from our partners with NATO. 28 countries. We had 7 that were paid up. Now we have a very much bigger number. We're getting $130 billion more. That's going to $400 billion. And that's money to really protect themselves, for the most part, against Russia. So nobody's done more against Russia, but it was never brought to my attention, and it perhaps wasn't brought because I didn't consider it to be real. And if it is brought to my attention, I'll do something about it.
Mr. President, what's in your healthcare plan that's coming on Sunday?
Well, we're going to be doing a health care plan. We're going to be doing a very inclusive health care plan. I'll be signing it sometime very soon.
You said 2 weeks when you spoke
It
to
might
Chris
be
Wallace.
it might be Sunday, but it's going to be very soon. We're also doing a full immigration plan. We're going to take care of a lot of things that for 25 years they've been trying to get an immigration plan. We're going to be doing merit-based immigration. I'm sure you'd be happy to hear that, but it's merit-based, very powerfully merit-based. It's going to be very inclusive. It's going to cover just about everything that most people would have said couldn't happen, and we'll be releasing that over the next couple of weeks. So we're doing a healthcare plan. We're doing a immigration plan, and we're doing another one that's very important, are the drugs, prescription drug prices. We pay the highest of any country in the world by far. You look at Germany and you look at UK and Canada and other countries, and they pay a fraction of what we pay. And we're doing a series of signatures, which I've done, and one goes into effect very soon. But we're doing matching grants and all sorts of things that are going to bring our drug prices down at levels that nobody ever thought possible. We're doing things that nobody ever thought possible. The bad news is the pharmaceutical companies aren't exactly in love with Donald Trump, and they'll advertise. They've already started it. I see they've already started. I've seen the ads. And anytime you see an ad from a pharmaceutical company against me, you know that means the drug prices are coming down. But they're going to be coming down to a level that nobody ever thought possible. We are, as an example, Germany has very low prices, and we have very high prices, many times the amount. And we're doing, we have to get, no matter what the price, lowest price in the world, that's what they have to give us. And right now we have by far the highest price in the world. We're going to allow states like Florida to go to Canada and to buy. Their prices are much lower than ours, so they're going to be able to buy directly from Canada rather than going through their traditional sources. And I think in the state of Florida, what will that cut the prescription drug prices?
Well, I mean, it depends on the drug, but there were some when we were doing the bill that you could get for 75% less in terms of what Canada would charge.
How about that? 75% less. So they're going to be buying it approximately 75% less. What we're doing really, which is the most, we're doing rebates, and the rebates are going to go to the people, and they're going to go in the form of drug reduction, drug price reduction. But we're doing something called favored nations, and nobody thought anybody would ever do that. But look, I want what's right for the people, and it's been very unfair. So favored nations, meaning if another nation's paying lower and another nation's paying even lower than that, we take the lowest nation in the world, and that's what we have to pay. Right now, we're paying many times the lowest nation in the world. You have some of these socialistic or social, well, I guess you could say socialistic nations, they have drugs at a low price. Well, we'll use that to our advantage because we're going to be getting the price that they have. Now, what's going to happen is their price will probably have to go up, and our price will go way down. And I could see 50, 60, 70%, maybe more than that, reduction in prices, and no other president will ever do that. And the heat I've taken in the last couple of weeks because of that is unbelievable. And frankly, the ads I've taken are unbelievable. It's sort of incredible. You see drug companies taking these massive
When
ads.
we did our bill, I've never seen more ads in Florida, but the pharmaceutical was doing. I mean, I have young kids. I'm watching like Paw Patrol with them, and it goes to commercial, and it's saying that Florida, they're going to bring in all these drugs from Djibouti that's going to kill everybody. So, I mean, it was unbelievable how they papered the airwaves. A lot
You'll
of
be
money.
buying the same drug that you paid a fortune for half the price, maybe better than that even. And the exact same drug made maybe in the same factory, the same company, and you're going to be paying a fraction of the price. But the drug companies are not happy. And look, we want them to be happy. We want them to do well with the vaccines. We want them to do well with everything. But they've made a fortune, and that's why they can afford the ads, that's for sure.
Yeah.
So when you see ads against us, and me in particular, because I'm the one that's, I've signed 4 acts, we'll call it executive orders, and they're the most powerful ever signed in this industry by a factor of about 20. And it's going to bring your drug prices down to a level that you've never seen before. So I'm very happy about that. The drug companies don't contribute to my campaign. I don't need their money. I haven't asked for their money. And if they did, it wouldn't matter to me anyway. But I am not somebody that's reliant on the drug companies. And we call it Big Pharma. Big Pharma is probably the most powerful lobbyist of any lobbyist there is, probably. I don't know. Maybe the lawyers' lobby is pretty powerful, too. But Big Pharma would be just about up there. And we have to do what's right. They've been talking about reducing drug prices ever since I can remember, ever since I've been starting to really watch politics with interest, which was actually at a very young age. But we've been talking about drug price reductions and prescription drug reductions. And I will tell you, you're going to see the biggest reductions in the history of our country by many times. We're not talking about a 1%. And as you know, last year, for the first time in 51 years, drug prices went down. But marginally, but they went down. First time in 51 years. So I was president, and drug prices went down first time in 51 years. Now you're going to see numbers that you wouldn't even believe, and it's going to be fair. It's not fair that other countries pay a fraction but I mean a fraction of what we do. We pay all research and development and promotional costs and everything. It's put onto the United States. They pay nothing. And then on top of it, they say, this is what we'll pay and this is what it is. And the United States will pay the remainder of the difference. I mean, this is the way they buy. They go and I won't mention names of countries, but they say, this is what we're going to pay. The United States will make up the difference. And that's not going to happen anymore. Okay, thank you all very much. We appreciate it. Thank you.
Thank you.
Thank you very much.
Press, thank you. Press, thank you. We're done.
Are you up for election this
Press,
year?
thank you. We're done. Let's go.
I'm with you on the ballot.
Okay.
Yeah.
Press, attention.